The Alliance for Strong Families and Communities and Aramark are pleased to honor Woods Services of Langhorne, Pennsylvania with the 2019 Aramark Building Community Organizational Leadership Award. This award identifies and celebrates a change agent elevating its staff and communities in leadership with equity, sustained community change, and measurable improvement in health and well-being. And there is no better example of that than Woods Services.
Population health for us is not just about the caring for the people we serve, it's also caring for the people that work with those we serve.
As the umbrella for a network of 6 organizations that operate as a continuum of care across Pennsylvania and New Jersey, Woods Services provides innovative, comprehensive, and integrated health, education, housing, workforce, behavioral health, and care coordination services to 22,000 children and adults in the intellectual and developmental disability, child welfare, behavioral, and brain trauma public health sectors who have complex and intensive medical and behavioral health care needs. Woods relies on the strength of its highly trained staff of 6,000 who are dedicated to helping people achieve their highest potential and live a fulfilling life.
Between the Woods and Woods affiliates, we all service different populations and different nuances a little differently. But that doesn't mean that we can't be collectively effective. I think that's what the population health model offers. It offers you to understand your role in that continuum, but the ability to be able to really tailor your efforts to the population that you're serving while still reaching a collective impact.
So we have attacked population health from really 2 angles. We have developed an integrated patient-centered medical home at Woods, where we serve both our clients in a healthcare capacity, primary care, prevention, and also behavioral health and specialty services, but we also provide care to our staff free of charge.
As an additional investment in its staff to make sure they have the knowledge necessary to provide the highest level of care, multiple partnerships have been established with colleges and universities to provide low-cost, on-site, cohort-based degree programs. Woods has experienced a 92% employee retention among on-site academic cohort participants, and 168 employees participated in higher education opportunities over the last 2 years.
The alternative is then we've been able to create career ladders within Woods in our network where you might start as a direct care worker and you might become a nurse, a teacher, a psychologist, a therapist, and you also may get an administrative role and ultimately become a CEO. And we think that that kind of investment from a population health perspective for our staff is key, because they're ultimately the ones that are going to make sure that we provide high quality services to the people that we care for here at Woods and our affiliates.
Woods also demonstrates the power of its partnerships, as it has built the capacity of Woods Community at Bryan's House to become one of the largest group home providers in the eastern region of Pennsylvania, offering a natural continuation of services, including health care at Woods Medical Center for young Pennsylvania adults when they leave Woods. The Medical Center at Woods integrates primary care and behavioral health care using a patient-centered medical home approach, which has resulted in improved care coordination, better health outcomes, and reduced stress for the individuals Woods serves.
The key part of the outcome was that we had a reduction of 39% of inpatient hospitalizations. And that is really good. It's good for our health system where costs are high when you deal with Medicaid and Medicare, but more importantly, it is also important for the client that then can stay and be more safe in their own home or their environment at Woods.
In addition to providing high-quality direct care, Woods works with legislators and policymakers at the state and federal levels, advocating to reduce the fragmentation of services for people with intellectual disabilities. Leadership team members of Woods and its affiliate partners also work closely in their respective local and state communities with networks of provider organizations, advocacy organizations, and families to advocate for change in these areas.
At the heart of Woods' population health model, and what really attracted Legacy to the table, was a genuine and true trusting relationship that said, rather than a single agency be all things to all people, what if we could be the Super Friends? What if we could find organizations that were experts in their chosen mission and path, and we could bring them to the table and partner in regard to the services that they provide.
Please join the Alliance for Strong Families and Communities and Aramark in recognizing Wood's resources with the Aramark Building Community Organizational Leadership Award.
I think we've demonstrated that, and that's why we feel so honored to be recognized for it, because you really have a group of leaders, of staff that have come together and said, we want to make that difference in Pennsylvania, New Jersey, and other places. And I think it's a model for Alliance members that don't be scared of partnering, don't be scared of joint venturing, don't be scared of merging and affiliating. As long as you understand what everybody brings to the table and you use that, you can really make community impact.